Hi, everyone. My name is Daniel Sibley. I'm a researcher and kinesiologist at the University Health Network. And as we gear up for Living Donation Week 2023, I'm so excited to share with you some of the research that we are doing at UHN. In particular, our study, Prehab to Prepare Living Liver Donors for Enhanced Recovery, or PROPELLER. And I'm pleased to be sharing this research on behalf of the principal investigators, Drs. Hans Clark and Daniel Santamina. And today I'll outline kind of why we're doing the study, how it's being conducted, and our results to date, as this is an ongoing trial. So let's get right into it. Major surgery is like running a marathon, and both require training. So surgery is a wonderful tool for preventing, treating, or curing illness, but this doesn't mean that it's easy on the body. It often requires a period of recovery. But what if, like a marathon, we started training and preparing before the event? This is the rationale for prehabilitation, and it's the process of improving health before surgery to enable the patient to better tolerate the treatment. And we tend to see that individuals who engage in prehabilitation recover sooner and better than those who do not. So in terms of the benefits of prehabilitation, we do see through the literature that individuals who participate in prehabilitation demonstrate improved physical function both before and after surgery, improved psychosocial well-being, again, before and after surgery, as well as fewer surgical complications and a shorter hospital length of stay. And these benefits have been documented quite well in certain types of surgeries, including orthopedic surgeries and cancer surgeries. And within these populations, we tend to recruit individuals who are frail, sedentary, and have quite low baseline health as they stand to achieve the greatest benefit. But we don't have much evidence related to prehab in healthier surgical populations, like living liver donors. And this is the purpose of PROPELLER, or Prehab to Prepare Living Liver Donors for Enhanced Recovery. And I'm so pleased to speak with you about this study today. So living liver donors are needed to satisfy recipient wait lists, and preserving health and quality of life for donors is a priority as they receive no direct medical benefit from this wonderful service that they are providing. We know that donors must be in good health to be eligible to donate, but this does not mean that the surgery will be easy. In fact, 1 in 4 living liver donors suffer from pain, trouble sleeping, or impaired functioning up to 6 months or sometimes more following their donation. Some of the risk factors for experiencing these disturbances include a higher BMI, fatigue, less physical activity, as well as mood and anxiety disturbances before surgery. And in other groups, prehab has been shown to improve these risk factors. So the main reason this study is unique is because living liver donors are already in good health. But one of the main reasons it's so important is because there is a reason to believe that prehab can prevent some of the adverse effects that donors experience. But this is untested. So what do I mean in terms of prehabilitation? Well, we deliver exercise, nutrition, psychology, and peer support to participants. And these are delivered by a diverse team of health professionals, including kinesiologists, dietitians, and psychologists, as well as peer support from individuals who have previously undergone this procedure. So PROPELLER is a feasibility randomized control trial, or RCT, of 30 living liver donors from the Transplant Center and the prehabilitation program at the University Health Network in Toronto, Canada. So in terms of the study procedure, once a donor is identified by the Ajmera Transplant Center, they are screened for eligibility. And eligibility criteria for PROPELLER includes someone who is undergoing living liver donation with English literacy and at least 28 days between the time of consent and the time of surgery. So once the participant consents, as is depicted on screen, they are randomly assigned to the intervention, which is prehabilitation, or the control group, which is where we ask participants to continue their normal lifestyle behaviors. Then we track both groups throughout their preoperative and postoperative course using assessment and some questionnaires. So in terms of the outcomes, what are we looking for from this study? So we want to know if delivering prehabilitation to living liver donors is feasible. So these ask questions such as, how many donors can we recruit into the study? And once recruited, are they going to stay and participate within the study? What is the retention? When we deliver prehabilitation, is this a safe intervention for this population? And how long do we typically have to deliver this intervention in terms of our prehabilitation window? And speaking to the supports that I mentioned previously, are the living liver donors adhering to the supports and the recommendations provided by the research team? We also want to know how effective prehabilitation is. So in both groups, we are measuring both before and after surgery physical fitness, sleep quality, physical function, quality of life, mental health, pain, and surgical outcomes such as length of hospital stay, complication, and readmissions. In addition to these important metrics of health and recovery, we also want to understand the experiences of living liver donors, how they felt, how satisfied they were, how we can improve as care providers and intervention deliverers. This is the purpose of the qualitative interviews, to understand the satisfaction that participants have while participating. So as I mentioned, this is an ongoing trial, and in terms of our progress to date, 74 donors have been identified as potentially eligible for the study. And of those that were deemed eligible, 42% have agreed to participate in the study. This has led us to 22 out of our target 30 participants as of today. And 12 of those participants have undergone their surgery, completed all their assessments, and finished the study. And we have conducted 7 qualitative interviews to better understand the experiences of participants. So in terms of an expected completion date, we are expecting to complete the study in the summer of 2024. And I'm very much looking forward to sharing the results of this study with all of you next year. And in terms of our proposed impacts, we'd like to improve the quality of care and recovery for living liver donors using prehabilitation, as well as to inform the design of future larger studies that wish to continue this mission. And none of this would be possible without the PROPELLER team, an interprofessional group of clinicians and researchers from the Ajmera Transplant Center and the Prehabilitation Program at UHN, as well as the University of Toronto. I'm so grateful for your time and attention today. So thank you for listening and have a great day.